Welcome back to the Breakthrough Medicine Conference. I am your host, Dr. Lori Bouchard. I am so excited about this next speaker, Dr. Jessica Peterson. Today, we're going to be talking all about the clinical pearls, her as a functional medicine doctor and chiropractic doctor, and the 13 years experience she's had in medicine. She's going to share tons of wisdom on her side as a patient and her own journey with her health and sharing the many things that we need to know as practitioners. Welcome, Dr. Jessica.
Thank you, Dr. Lori, for having me. It's an honor.
I'm really excited to learn more about what you've gone through. I know that you're an extremely heart-centered practitioner, so I want to hear from that side as a patient, but then you as a phenomenal, brilliant doctor to hear all about what you found, the research, and all the things that you've done clinically on your own journey.
Well, thank you. I'm excited to share as you've been witness to a lot of this journey along the way. It's been really enlightening to not only be a doctor, but be a patient, and to be able to now share this experience. And like you said, hopefully enlighten many is a privilege.
Amazing. Okay, well, why don't you go ahead and take the floor?
Okay, so we're just going to screen share here. Okay, so here we go. As Dr. Lori said, I'm Dr. Jessica Peterson, and I have been a chiropractor for 13 years. My background has always been in health and healing. As a small child, I was absolutely fascinated in even just how the body could, for example, just heal a cut, heal a broken bone. There was always an intrigue or an interest in the body's innate wisdom in how it could heal itself. So it was very natural for me to pursue a career as a chiropractic physician. Over the years, I was often told, "You're the healthiest person I know." I had prided myself on being a role model in the community amongst family and friends, and always kind of took the responsibility to practice what I preached, walk the walk, talk the talk, and do everything I could to inspire those around me. So this picture is of myself and my husband. We were actually traveling the world just in November of 2019. This is a picture of us in Madrid, feeling amazing, feeling fantastic. We were feeling the best. We were planning for an incredible 2020. Had no idea what was to lie ahead, of course. And fast forward literally 2 weeks, I had come home from this trip with a mild toothache. It was something that was, fairly unusual for me. Actually, I have a history of what I thought was pretty good oral health. Had never had a cavity in my life, was regular with my checkups, my cleanings, etc. So this mild toothache was something to pursue. Really didn't think it was a big deal. Lo and behold, it was huge. So how did I go from being the healthiest person that most people knew to having a massive stage 4 breast cancer metastasized to my right maxilla diagnosis? It was a shock, an absolute shock. However, my biggest blessing to share with all of you today is that that picture on the right, thankfully, right, was the before. The picture on the left is today. So my message today and my opportunity is to share kind of how did I go from one to the other? How did it start? What were my lessons along the way? And how can we as providers take this opportunity to really, like Dr. Lori has established with this entire conference, encourage all of us to think outside the box, help people heal as a whole, and live the best quality life we can. I'm going to tell you a little bit about how my story started. This story was when I was 12, actually, is how this story whole started. You can see over here, I just have a picture of a blizzard road. I was 12 years old. My family and a friend of ours were in a terrible, severe car accident. It was absolutely awful, and I suffered severe trauma to the front of my mouth. Thankfully, at the time, I had some braces that actually held my teeth in place. The hope and goal was that my bone would heal around while those braces were kind of stabilizing things. My face had actually turned and was slammed into my brother's shoulder, kind of making a complete impact into my face. Over the years, that bone did not survive, which actually resulted in placing 3 implants into the front of my front teeth to be able to replace the teeth that didn't survive in that bone. That was 12 years after the car accident. Fast forward another 12 years after that, and I just started to develop some bleeding over the gums of those implants. That led me to actually pursue a cone beam scan by a biologic dentist colleague of mine who took this above image here. To everyone's shock, it was evidence of what was called at the time peri-implantitis. Looked like my body was having a severe reaction to the titanium, even though they had been in place for well over a decade. So I will never forget the dentist's reaction when he first took this scan. He literally dropped the pen on the table and he said, "You're toxic as heck," right? Fill in the blank. "You have to get those implants out." So I immediately took his advice. I couldn't believe what was going on. Seemed like I had severe bone infection. Followed his advice, replaced the implants. Oh, let me go back here. Replace the implants with a bridge, which you'll see over on the right-hand side of the screen. This was the 6-part bridge that was replaced when those implants were removed. Now, I followed up with those implants being removed with, at the time, an aesthetic dentist, a dentist who had followed me the entire time post my trauma. No mention of no biopsy, no anything. This seemed like reaction to titanium. Fast forward 6 to 8 months, and I had an infection that developed post implants being removed. That infection seemed quite uncommon, and it warranted further looking as to what was kind of going on. The result or the recommendation was simply an antibiotic treatment. Seemed like nothing more than an abscess. We fast forward again 6 months. That was when I was in Madrid with my husband, had this mild toothache, seemingly related, maybe, maybe not. Pursued with an endodontist who took this scan here. It was no average toothache. Immediately, we did a tooth extraction and did a biopsy. The result actually was a massive tumor that had developed and infiltrated my sinus almost all the way up to the base of my brain. I did have a visible tumor that developed over time on my palate. And again, upon further scanning, you can see that the tumor actually had destroyed the majority of my maxilla. Over the course of that year, the tumor actually protruded much farther up into the gum under my lip right here. This whole path happened exponentially, really over the matter of 1 year, possibly a year and a half. Did we go from slightly bleeding gums all the way to a massive tumor that was infiltrating next to my brain. So how did I get through this? How did I survive? I survived with 3 leading principles, and it was all outside of the box thinking. None of this was linear at all. In fact, there were many spikes and drops and ups and downs, turns arounds, and getting back on the road again. It was filled with a tremendous amount of these 3, like leading principles that kind of led me along the way. Number 1, it was all about the terrain. I had been taught that from the beginning of my career. How a body gets out of balance is usually a combination of thoughts, traumas, and toxins. As I learned going through this process, the most important thing to assess and heal that terrain is to test, assess, address, don't guess. Thank you, Naisha Winters. Number 2, the mind. The mind enhances healing by 87%. This was a game changer for me. I'll explain why in a moment. Root cause healing demands extensive attention. Radical collaboration provides profound results. It took a team, and it took a huge team. There was no one provider. There was no one modality. There was no one discipline. There was no one lane that I stayed in. This was a literal global effort. What does radical collaboration look like? It started with Dr. Bob Rakowski. I feel honored to actually be presenting with him at this conference. He's been a mentor, and now I can honestly say extended member of my family for a number of years. He has taught and trained physicians for decades about the perfect storm of cancer. I had taught it to my patients over the years, and here I was living and breathing, being an example of how to undo this perfect storm that had been brewing in my own body. And the whole combination of high acid, low nutrient, low oxygen, chronic stress, suppressed immune system, and chronic infection. Our role was to leave no stone unturned in assessing the root cause of what was going on with my health. He not only is a phenomenal physician, brilliant mind, he's an incredible motivator and a sage of wisdom. He immediately encouraged me as far as taking ownership of my mental emotional health and really accepting, as he quoted and encouraged me to lean into this, the way of the peaceful warrior. And the lesson there within is that this indeed was my training and that the results were going to be epic. Bob, you were totally right, as always. Initially, my journey here led me from Minneapolis to Reno. Upon collaboration, immediately we thought that the right course of action was going to be a course of IPT, or insulin potentiated therapy. We pursued some testing through the RGCC grease test, which in the end, it wasn't the right route for me. We definitely tried it. It didn't work. We kind of figured out another route. So I had gone to Reno, worked with Dr. James Forsyth, again for the IPT, but what really changed the course of my healing was meeting with this man actually right here. His name was Dr. Majid. And what happened when I was waiting to see Dr. Forsyth was a story I really want to share. Dr. Majid was one who was meant to go over your supplements, to kind of review where you were at and what you were already doing in your healing. I impatiently, as a very the old me was an incredible achiever, a doer, a box checker. I wanted to kind of move through. I was acting on intellect, my intelligence, everything I could possibly do to research and find my way through this. So I meet with Dr. Majid. I'm ready to go through all the supplements that I know, my nutrition, et cetera. And the very first question he asked me, he looked at me square in the eyes and he said, "How much do you love yourself?" Annoyed, I said, 100%, like, come on, let's go. Let's get to the point. What do we got to do here? I said, 100%, of course I love myself. That's why I'm here. He very, very calmly said, "I don't believe you." He said, "Your intelligence has brought you here. You need to trust that you have collected and collaborated with experts around the world to help your physical healing. I'm here to tell you that 87% of your healing is mental emotional. That's where your work is." I begrudgingly wrote down the number is 87% in the notes. And would you believe my first question to him was, "Where did you read that? Where's the research? Show me the data." The soft smile on his face, he told me a book he actually read that specific data in. This was a man who survived Chernobyl. He had done over 200 chelations to heal his body. And this was his advice to me. I figured I better start taking it. So I dove into healing my mind and healing my heart. But first, I had to find that research article. I had to find that reference. I had to figure out where that was. The book that he pointed me to was Dr. Carolyn Leaf's book, Who Switched Off My Brain. I can honestly tell you this right here is the exact excerpt from, if you were to look this up on Amazon, it will tell you in the description of the book, right? Research shows that as much as 85 to 95% of mental and physical illnesses are a direct result of toxic thinking. Now, I looked in the back of the book, the front of the book, every single page of the book to find where the research was that proved this 87%. What resulted was literally me reading this book 5 times, underlining word for word, looking for the proof of this 87%. What resulted was me transforming my mind and actually finally being drilled into me the importance of my thoughts, my emotions, and the responsibility that I had for my healing. So I dove in. I dove in hardcore. I dove in with every expert in the field. I dove in with every, with everything that felt like a yes within me. I dove in with where I felt led, what resonated, what I could apply, what I could unlearn and relearn and unravel and heal. It was a tremendous effort followed by my inner knowing. And it truly has been what has carried me through this entire process. And I will say to every provider that's here listening today that I firmly believe it is our responsibility to impart to our patients the belief and the hope in healing. I have been trained from day one as a chiropractor, the power that made the body heals the body, the power of innate healing. And we must, as providers, encourage our patients to access that tremendous wisdom within. So I'm going to share a little bit more about that 13% of healing, which was critical, amazing, and incredible. So while I was working on my inner self, I needed to know more. I needed to know a lot more. I was still the researcher. I was still the doer. I was becoming the beer, but that was a big process for me. It was a big journey. So in the meantime, right, I'm kind of using my faculties of what I could to kind of learn more. I had met at this point over the 18 months, actually, we had probably met with 7 oncologists, 4 medical oncologists, 4 radiation oncologists, 5 different surgeons. And it was not met with what sat right with me, right? It just wasn't. I was looking for more. I was looking for more than the standard of care. And would you believe that each one of the medical oncologists I met with offered minimal, dismal options? It was shocking. And yet they were almost all different. It didn't make sense to me. It didn't make sense of the why. No one was really kind of putting these pieces together. What was going to work best for my body? Why were people making different decisions? And based on what data? Just wasn't available. Up all night. I will tell you, no, this is not the healthiest, right? To be staring at a computer screen at 3 a.m, but that's where I was. That's where I was. And I will tell you, honestly, it was a God moment. Here I was looking everywhere, Googling, like, a scholar, pouring through research articles, trying to figure out more about my diagnoses. I was ER/PR negative, HER2 positive, breast cancer metastasized to the bone. Would you believe that who I found, the lecturer I found, was Dr. Wafa, who was an oncologist actually in Egypt. I couldn't believe that here I was at 3 a.m. listening to this woman who is an expert on breast cancer. And I looked to see where she is teaching, and it was through the IFM, the Institute for Functional Medicine. I thought, how in the world am I connecting with this woman who knows more than any oncologist I have met with to date? She's from Egypt. I got to reach out to her. It was a moment where it was God-led, I'm sure of it. Right now, I followed everything I possibly could. I sent a message to her, and her goodwill and her incredible passion for healing people was brought upon into my life, and we started a journey together. So she was working with me on my terrain. She was working with healing what I could. We were zooming across the globe at different time frames. And all this time, no one is talking about my teeth. If you remember that scan, it was pretty shocking. I mean, that was not healthy bone at all. I was quite concerned. I had not one a mobile tooth, but 3. So again, truly in the middle of the night, I'm listening, I'm looking, I find a podcast by a guy who had connected breast cancer and dentistry. His name was Dr. Stuart Nunnally, and he was in Texas. I figured, hey, I've always been given the advice that you want to surround yourself with people that are smarter than you, surround yourself with the experts. So I reached out to him. I thought, he's an expert in it. I'm going to ask him directly. I reached out to his clinic. I said, I need a miracle. I'm hoping for someone to be able to consult and connect some dots. Again, it was through the goodwill of a provider and someone willing to think outside the box and help. He contacted me directly. He said, I know a guy. I studied with a guy actually in Minneapolis. How far away is Minneapolis from you? Or it was actually 20 more minutes from me. Couldn't believe it. But the one person that he had recommended was literally 20 minutes down the road from me. He was an oral and maxillofacial surgeon. He had an extreme interest in biologic dentistry and natural healing. Great, gonna reach out to him. Fast forward, I find information from Dr. Kelly Blodgett, who practiced out in Portland, Oregon. I contact Dr. Blodgett. Dr. Blodgett says, hey, you're in Minnesota. I know one person in Minnesota. His name is Dr. Mark Ruskowski. I couldn't believe the very two people that I reach out to independently both recommend the same one person in Minnesota. Here we had a triad of dentistry that was ready to help address my healing. We had to look a lot deeper, right? When we're looking at root cause healing, we want to remove the root to whatever is going on in the body. Is it thoughts? Is it traumas? Is it toxins? A combination of both. What's going on in that body? That's that perfect storm that's creating the cancer to grow in the first place. If you don't change the environment that allowed the cancer to grow, what are we doing, right? We can't just keep treating the symptoms. Dr. Kelly Blodgett out in Portland, Oregon, took a look at my scans. Now remember, I had a massive dental trauma when I was 12 years old. I had been followed through dentistry for 30 years. I can't tell you the amount of scans that I had done, the amount of people that had looked in my mouth and assessed my oral health. Kelly Blodgett took a look at my scans, and the first thing he said is, why hasn't anyone ever told you about this infected root tip from when your wisdom teeth were removed 30 years ago? I said, you've got a jaw dropped. What do you mean there's an infected root tip? Opened an entire can of worms to understand the amount of people that are living with dental infections that are affecting their health. It's an area that is not connected well or integrated in patient care as far as looking at how it's affecting people's overall health. We know that each tooth lies on a meridian that connects to an organ system, the transmission of bacteria and toxins that can go through the system into the cardiac, to affect cardiac health, into the circulation. We know now that, the connection of dental health and cancer, of root canals, and especially breast cancer for women. And here I am basing exactly that. So you can see the picture on the left there is identifying where there's the infected root tip from a wisdom tooth extraction, again, 30 years ago. Now, what had happened when I had the tooth extraction to biopsy the bone is that it likely woke a sleeping dragon. It had really aggravated and made that infection incredibly mad, which I really believe was oil on the fire and caused this cancer to grow out of control. So you can see here, we sent off both a super floss actually to test the tissue, as well as the extracted root tip that you can see in the picture here for assessment through DNA connections to see what the bacterial load in my mouth was. You're not supposed to see red. This is the amount of bacteria, where you can really see that there was absolutely severe infection in my mouth. And not one symptom. Like bigger symptom other than this toothache over time, right? So this was absolutely shocking. We proceeded with things like IV ozone, IV vitamin C, injected ozone into my mouth, anything and everything that we knew, again, outside of the box to help to kill off infection and protect that environment. Conventional medicine continued to recommend courses of chemotherapy was basically the main thing. It was just pushing this chemotherapy. And here what I knew about systemic treatment, and what everybody knew about this was the likelihood it was just a guess. It was a shot in the dark. It was a Hail Mary. It was a maybe it'll work. Nothing felt right about it. I knew that maxilla, the sinus, got the smallest percentage of blood. Barely anything you put into your system was actually going to reach the tumor site here. Even if I were to pursue a route of chemotherapy, it wasn't going to reach here. Just the blood doesn't get there very well at all. So what else was I to do? Well, Dr. Wafa actually took it upon herself to consult with Dr. Nasha Winters. I had known about Dr. Nasha for years. I had read her book. I had recommended her book to many patients, right? I mean, it sat on my desk at my office. And it was on my radar many times to reach out and kind of join a training that she had started. I was fascinated with her work and how she was kind of breaking the mold and really being a pioneer in the field. So here, even though that had long been in my periphery, it was in my immediacy. So here, Dr. Wafa connected me with Dr. Nasha. She actually did a consult with her on my behalf. And the best recommendation actually was to pursue a realm of what was called photodynamic therapy. Not very common in the US, but you look globally, and this is actually much more of a common therapy. We don't really know about it. It's not super FDA approved for what's going on, especially for my case. However, when you start looking at what's working in the rest of the world, it didn't matter to me that it wasn't really approved or working in the US. It's working in Canada, it's working here, it's working there. Why it doesn't work here is beyond me, but I didn't have time to wait for it, and everybody knew that. So luckily, I was able to connect with Dr. Chris Duhan, who is out in Seattle, and his training was at Paracelsus Clinic over in Germany or Switzerland. I forget which location he was at when he did his training. Biological medicine for healing and health, specializing in dentistry. He there witnessed himself the healing benefits of photodynamic therapy, and referred me down here to Dr. Jennifer Millet, who practices just outside of Tijuana, where she could actually do this work. Packed our bags, got in a plane, and it was photodynamic therapy for me for 2 weeks. So we not only did localized PDT kind of right in my face, but we also did IV therapy as well. Worked with red light therapy. We did different nutrients that would be photosensitized by different light therapies, such as IV curcumin. We did it all. It was phenomenal. And I felt like we really had a localized effort kind of at that tumor site to really help to put out the fire so my body could continue to heal. Well, it did benefit substantially. There was a lot of die-off, and there was just a difficulty in that area for the tumor to do whatever it needed to do to actually clear my body. So unfortunately, I had an exacerbation within 2 months of having this therapy. Warranted a very, very quick consult with Dr. Nasha. And crazily enough, also my entry into her practitioner mastermind program. It became almost imminent that in order for me to heal, it was going to take, again, a community of providers that were skilled across multiple disciplines. And at her recommendation, to actually be a case study even within this program, to learn from the best about my case, and to really be able to bring forth my life's purpose. From the very beginning of this difficult journey, the words that were put on my heart were to transform, transcend, and teach. I knew it was my absolute purpose to completely transform my health from the inside out, to transform what was offered in the limitations of medical oncology, and to teach. Doctor itself, means teacher. And I knew that it is my purpose to share everything that I've learned, to be able to inspire and teach as many as I can going forward. So my motivation and my drive to kind of go through this was tremendous. We put everything into action as far as testing, assessing my terrain, and addressing it in the best possible way. It was a paramount effort, and we'll see more of that as we go through. So the next steps then were to connect me with what I needed at the time. Again, this was acute fire. It had really flared up. The concern was high. Within Dr. Nasha's network, she connected me with one of the top neurosurgeons at Barrow Neurological Institute in Arizona. Dr. Dr. Chris Smith was one of the top surgeons that she had referred several of her patients to go to with incredible success. Up to this point, no, I had not consulted with a neurosurgeon, but I had been turned down by 5 of them. I was told I was inoperable. I was told surgery was not an option. I was told it would be extremely disfiguring and deforming to my face. I was told quality of life would be terrible. It was just not something that anyone was willing to take on. Dr. Chris took a look at my case. He said, we can do this. So we pursued consults with Dr. Chris. He assembled an incredible team at Barrow, and within weeks, we had an appointment scheduled for a surgery. Also at this time, it seemed that, right, perhaps radiation was going to be in my future. This was something that I don't even go through. I don't have a microwave, right? I mean, I don't go through the medical detector at the airport. I haven't for 20 plus years, right? Saying radiation to someone in a natural healing field was terrifying. It was definitely on the back burner. I didn't really want to talk about it, but it was a possible option. That being said, the collaboration, the need at the time post-surgery was to indeed follow up, because I'll share in a moment kind of the results of that surgery. We collaborated with Dr. Pinzone and UCLA Radiation Oncology to incorporate hyperthermia and radiation, which when you look at the studies and you look at the research on that, the effectiveness of combining those two far supersedes just doing radiation alone. In addition, I was in a strict ketogenic diet, incorporating hyperbaric oxygen therapy for healing, amongst several other healing modalities to maximize my results. I will share here too, post-surgery. I also went back to Houston. You'll be able to see the after here in a moment. I did go to visit with Dr. Jerry Tennant, who specializes in voltage. Healing is voltage is his motto. Visited with his clinic there to get a full body assessment on how my body was doing. Crazily enough, even despite everything that was going on, most of the providers in the clinic were shocked that my assessment was healthier than many of their own. That's a tribute and a testament to really doing what we can throughout and throughout healing. So let me just fast forward to kind of what happened. What did surgery, radiation, and hyperthermia actually look like? I will tell you, 2 days before surgery, the plan that Dr. Smith had outlined was possible to change. They were actually looking at doing a severe flap surgery for me, which actually would have indeed, it's up here in this picture, been cutting almost half of my face off. And there wasn't nothing in me said move forward with that, nothing. And so with incredible self-advocacy, a ton of tears and tremendous support, we agreed on going forward with our original plan. And we actually brought on last minute a plastic surgeon that suggested some incredible ancillary options to really bring this surgery home. So instead of the above picture there, you can see that this was me immediately post-surgical. That massive tumor that was in my face was actually able to be removed, both intranasal and transoral. So it's all done from an endoscopic approach. It was absolutely fascinating and incredibly successful. Within weeks, I was able to move on to about 6 weeks of encouraging my healing. I was able to move on to a short course of radiation at UCLA, again, in combination with hyperthermia at the Hyperthermia Cancer Institute in Santa Monica, California. The collaboration amongst the providers was phenomenal, and it was agreed that it was the best course of action. Here's a picture of the home hyperbaric oxygen unit, that we purchased to be able to use. Actually traveled with this and traveled with a red light therapy to have immediately available for healing. There were a tremendous amount of post-surgical, post-radiation therapies we did to actually pull out the toxic radiation and actually treat very common side effects of radiation, such as radiation burns. On my face, I had not one radiation burn on my face at all, but I did have a severe radiation burn on my tongue, which is terrible. I mean, it was hard times, a lot like that at all. So I was really looking for options on how to heal that. And amazingly, what was actually first introduced to me when I was doing photodynamic therapy down in Mexico was methylene blue. Methylene blue is an amazing mitochondrial support facilitator of healing. I was able to actually use that as a mouthwash and a rinse. You can actually see where the radiation area completely took up the methylene blue when I would rinse my mouth and be able to use it for healing. So we had coconut milk popsicles and methylene blue. We had rinses and red light therapy. And I mean, you name it. This girl was healing the inside of her mouth like crazy. And we were on it. But I will tell you, it was through this massive group effort. None of these recommendations were ever communicated or even suggested within a medical model. So this is where collaboration is key. The information is there. What works needs to be able to be communicated to our patients, and we cannot be waiting for a clinical trial to prove every single thing. By then it's too late. Okay, so during this time, I am healing. This picture right here is actually 2 weeks post-surgery. I couldn't believe it. I was actually healing beautifully, doing really, really well. This is myself and my husband when we were in Arizona and healing. And at this time, just when you think, going through cancer, massive stage 4 cancer diagnosis isn't enough. We also, remind you, we're in the middle of a pandemic. I, in addition, was experiencing a profound emotional stress, experiencing probably the biggest betrayal of my life. I was dealing with signing off and leaving a company that I had been with for 13 years. My entire life was transforming. We had about every obstacle against us, and yet we had every amount of love and support with us. So we were not the only ones kind of fighting this fight. It was absolutely profound, the mental emotional journey that brought us and got us through this. Like we said at the very beginning, right? It's thoughts, traumas, and toxins that we're looking at. You really have to look at root cause healing. Yes, did I have an actual literal infected root tip? Yes, did I have trauma, terrible, terrible trauma to my face? Absolutely. Was it harboring infection that I couldn't see? Was it a hidden cause of my cancer? Completely. But I was also living and working in a world that wasn't following my dreams. It wasn't following my heart. It was pretty toxic for my life, and that had to change. It was time to move, to spread my wings, to live my life, to serve others in a way that was full of love, ethics, and excellence. And to be able to, if you would believe that this picture, when I told you I joined Dr. Naisha's Physician Mastermind program, day 1 of her mastermind program was the day of my surgery. It was actually the exact day I had that surgery. 2 weeks post, I was there live on my next training, ready to learn so that I could teach and serve the world. So let's take a look at where this girl is healing now. Where am I? What's happening with my health? You can see here in February 2021, this is my post-surgical MRI. It was incredibly successful. They were able to remove everything visible that they could, every visible sign of tumor within that maxillary sinus, within everywhere that had traveled in my head. Fast forward here to August 2021. And look how beautiful my sinus is right here. You can even see the change in 6 months at how much this is healed. A lot of this over here was post-surgical inflammation, not necessarily remaining tumor. However, you can see the dramatic healing that has happened. I'm excited to share with you briefly about a breakthrough scan that I was able to have done actually just this past weekend. So the timing here couldn't be better to be able to share with you kind of what's available for patients, and it is worth the travel. My favorite part here of the report was that there is no worrisome lesion identified literally in my entire body. So never before has there been a scan available like this, especially in conventional medicine. This is definitely, it was a whole body MRI that was able to look at 10 times more images than a regular MRI would at an incredible detail. And I'll share that with you in a moment. You remember my palette before, here's my palette after. Looks absolutely beautiful. We'll work on a little dental prosthesis, but you know what, this toothless smile is just fine. I'll take it. We got a lot to smile about. So here I am today. and doing absolutely amazing. I'll share here with you, and we'll do a screen share about Prenuvo in just a moment, but I'm just going to end with this picture right here. Actually, I have one more slide, I believe. This is my why. This is my family. These are my beautiful kids. This is my daughter, Abby, who is 15, and my son, who's 12 and a half. I've been together with my husband for over 20 years. And I will tell you that this, I wanted to just share that little bit about me, about how my why is and how grateful I am to be here today and to be teaching and training with all of you. It's literally quite a miracle. So my whole message really in all of this, when I think about all the physical modalities, when I think about everything that I did, I thought about all of the ways that we, going back to that first slide, how healing is never linear. The twists, the turns, the changes along the way, the changes in course of action, the people that stood with me the entire way. Those were essential parts of my healing, right? The doing, there was a tremendous amount of doing. The effort and the work and the discipline was like no challenge I've ever been up against in my entire life. But what I can say with 100% confidence is this quote here, which really, the irony is that it's by a medical doctor, and we love medical doctors, but it was amazing that this was a Harvard medical doctor who says here, the wisdom of the body is responsible for 90% of the hope of patients to recover. I promise at this point in my healing, I don't need to look for that research. I don't need to look for who wrote that quote, right? We know this. The body has a super wisdom that's in favor of life rather than death. This is the power that we depend on for life. All doctors are responsible for letting their patients know of this great force working within them. So I share that with all of you to encourage that, because I think that is what will help people to continue to go on and to align with these beautiful providers that are here listening today, wanting to help and serve those that are wanting to overcome their journey. So I thank you for hearing about my story today. I know it was kind of a lot and fast, but it will continue in the most positive way together. Thank you.
Dr. Jessica, I am just blown away. I'm bawling over here. I have goosebumps from this whole story. You were so inspirational and such a powerful person and such an advocate, not only for yourself, but to even hear how your story is empowering so many other people. You really did travel the world and listen to your gut the whole time. And I love when you're saying too about the beginning, when you're just this go, 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 ask for the research, ask for this, and just that type A mentality. And for you to go through that and personally have to shift gears and say, okay, this, like, do I even love myself? Like, oh, like, that is just like, I can see how that doctor just stood out from all the others, just asking those real questions of, okay, we got to this place for a reason. Now, what are we going to do that's different than what everyone else is saying? And how that just changed the whole trajectory of your healing process as well.
100%. It was really quite a profound experience, and it was all divinely guided. You can absolutely say that without a doubt. And yet it is for a complete reason, is so that not every journey has to have such a, I just feel like I feel such hope. I feel such optimism. I feel that together, like I said, it was Dr. Babakowski who originally just even said that phrase, radical collaboration, and that stuck with me from the beginning. And it was one that we just continued to look and align and work with as many providers that truly believed in health, believed in healing, and believed that it was possible to overcome.
And it's such a mind shift from the typical patient that we would see generally, where they say, okay, what medicine are you going to give me for this cancer? And so it's really putting that ownership on the doctor. But this whole presentation, your whole journey is showing you had to do your own research, find the different doctors, all the different opinions. Like, even too many people put trust in just the one opinion and say, oh, okay, this is what I should do, so I'm going to do that. It's like, this is your life that we're talking about. You need to interview these people and see if that resonates with you. And So far, it sounds like everything you're doing that's so exciting. Should we share the Prenovo imaging? I want to see where you are now. You're just so incredible. I'm just blown away by everything you've done, because it's a combination of not just these other brilliant minds, but you listening to your gut and doing the hard work, right? It's hard work.
It is a lot of hard work, but I'm so grateful that there are so many options to help people to heal. They are out there. There's definitely, when you look at medicine, although it can serve a very important purpose, I'm a testament to that. I used it, needed it, and I used it incredibly intelligently and never solo and never alone. So to understand the entire world of healing and figuring out and encouraging how to help people access those different modalities. So yes, I'm excited to share about Prenovo, as it's quite new in this country as far as being able to access that testing. And it's, I think, going to be a game changer for many.
Incredible. Did you want to share screen now, or?
Sure. Yes, we'll share here.
I believe they're getting Prenovo in Toronto as well. So it's coming to Canada for anyone listening from Canada.
Excellent. Okay, so let's just pull that up here. Good, we're good to go. So this was just a scan that I had actually, like I said, just done on Saturday. There's just one place in Silicon Valley and one in Minneapolis right now that are in the US. And yes, in Canada is there. And then I think there's 2 more locations in the US coming, New York and LA. But here's just an example. When I have gone in for standard of care follow-up, even following up with my oncologist, I cannot tell you the pushback that I have gotten from just requesting standard testing. And when I say standard testing, I look at even blood tests. The pushback is dramatic. I look at all the other additional excellent tests that are available. And when I've asked even just for support from a conventional oncologist, it's been an absolute no, which why? This is my life. The more information, the better. The no's that I have been met with have literally shocked me. The narrow scope when looking and assessing my health, not looking at my whole body, the effect that different treatments have had on my whole body. Instead, it has been, let's just look at her head and neck, and still no one knows what to do with me because it was breast cancer in my head and neck. So it's been like, which person is really overseeing my case, but it has been here to here and here to here only. So what is going on with the rest of me is where Prenovo offers an insight into the whole body. We know that at times breast cancer likes to travel. Where does it like to go? Brain, liver, lung, bone, right? So let's kind of see where things are at. I want to assess all those different areas of my body. I'm going to give you a quick screen share of what a report looks like from Prenovo, that I actually have access to my images at all times and can share them then with other providers across the board. Unlike, I can't tell you how many records requests I've had to fill out, or chasing down the actual physical disc, or hoping one provider has the MRI and the other one has the post MRI, and who's looking at what and comparing results. So this to me was a phenomenal baseline and way to assess overall health. Absolutely amazing. So let's look here quick at an example of what the images look like on a report that I have. See here, I'm going to go right to images. I won't go through any of these images extensively, but I just want to show you how well the scans are. They kind of, these are actually my images on the right-hand side. And I could slow them down at any given time. It kind of goes slice by slice. So this will show you the different, give you an idea of the different types of scanning that they do. I was in an MRI machine for 90 minutes. And then was able to actually get all of these results. So they can actually look at the size and quality of brains, look at pre-Alzheimer's, the size of your hippocampus, trauma, concussion, arterial blood flow. They look at hundreds of different types of screenings for cancer. It's looking at your pancreatic duct, bile duct, you name it, it's phenomenal. So here we go, we keep looking. They look at the arterial view, look at an entire tumor detection, which is absolutely fascinating, looking at actual densities of different tissues, all the way down to the fine tuning of your lymph nodes, the subcutaneous vasculature that you're actually looking at. It was amazing the detail that they were actually able to look at. So here is someone who had this entire maxillary metastasis. I had an affected lymph node, and I actually had a huge lesion in my L2. Never having actually treated my L2, it is completely healed today. You can look at this hole. Absolutely beautiful. Here's aneurysm detections, and I look at the vasculature of your head and neck. And I looked at my overall pelvis. Detail of my spine. Again, these are all fast forwarded. You can go click into any one of these and look at it in extreme detail. So my L2 vertebrae is absolutely beautiful. So it's fantastic. So the words of the radiologist who did my report were that it was crystal clear, not one single area of concern whatsoever. So you can then go in and you can click on each of the individual findings that they may have. For example, there's a thyroid nodule that I had had for well over 10 years that's still there, easy, something to monitor. I'll show you very quickly. For example, if I were to click on where that finding is, and I go right here, it'll actually show me on the MRI slice where that nodule is so that I could show any provider going forward. And it goes through each individual system. It's absolutely fascinating.
This is incredible technology. I'm so excited for people to have access to this. And is this something that you would use as once every 6 months you would have these scans done, or once a year just to see where you're at?
I think depending upon where you're at. So this test actually for me, it was recommended that I would go in 12 months. So I was very happy for someone to say, we'll see you in 12 months was about the best thing anyone could have ever said. So pretty fascinating when you look at it. I was actually amazed at the amount of information that you could get from this. I was just going to even look here if I could go. It is out of pocket. It's not covered by insurance. So it's about $3,000, maybe a little bit under. So you can look here again. Let's just see if I can find this really quickly. But you can actually go through your entire system, looking for densities or areas of concern, assessing everything from lung, liver, bone, brain, you name it. And for me, everything looks good.
This is so exciting. And I'm so proud of you, Jessica, for everything you've done. It takes so much courage. And I can see your purpose, like your children, your family, your husband. It's just so much love there and how much you've gone through. But the power of the body, and you're a true testament of how amazing the body is, and the will to survive. And I'm sure a lot of these therapies are not cheap, and you've had to do a lot of financial investigation, but at the end of the day, you're here, you're thriving, you're educated. So at the end of the day, what's the money really worth when you're here and doing so well? So I'm so proud of you, and I love hearing your story. I know that you're inspiring everyone that's listening. So thank you so much for your time and all the research you've done. Thank you so much for being here today.
Thank you, everyone who has helped me along the way, many of whom are speaking in this conference to share with all of you. I am more than honored to be here to hopefully inspire and share, to collaborate and to teach together and serve as many as we can. Thank you so much, Dr. Lori, for putting this on.
No, thank you. Good. So Dr. Jessica, if you have any final notes, any words of inspiration, or any advice that you would give to patients that are listening, or even for doctors to advise for their patients, I'd love to hear what that would be.
Thank you. I would first encourage every patient to never give up, to keep trying. There's always N of one. If someone hasn't done it before you, why not you be the first? Pursue your options and really think and look outside the box. Over and over and over again, I was met with the same disappointing standard of care recommendations. And those recommendations were the same as that were made to the person before me and the person after me. Standard of care meant standard of care. It wasn't individualized care. Individualized care is the way to pursue health and healing. Your terrain is unlike any others. So really look and work with providers who will actually, as Dr. Nasha has guided all of us, to test, assess, and address your individual terrain. I would say even from those who have had we've heard from the inside of conventional oncology, too many patients are actually putting all their faith in these so-called tumor boards. I was there too. I was really thinking that behind the scenes, you had a medical oncologist, radiation oncologist, surgical oncologist sitting there and brainstorming your case study and figuring out the best possible solution. And what we now know is really those tumor boards are the same day in and day out, year after year. Things are not changing. So it's up to you to change your health.
What a powerful message. And you're right. It's just the algorithms. You're just a number. It's just someone that's coming in and like amazing minds too, but you are just following that algorithm. So what a powerful message to remind all of us that we have this innate ability to heal and looking at the terrain. So thank you again so much for your time.
Yeah, surround yourself with good mentors, for those that believe in you. I know I did, and it is why I'm here today. So love to all of you, and thank you so much.